And then Jimmy will come on as one of our past presidents and ex officio too, and he's dealing with parents at home. Karina, you're COVID positive. You know what to do as from the youth perspective. Mipin Kaka's got a over 85-year-old one of our past that she's going to do. And then, of course, Chan and Consura Kanti also were tested positive, and they have taken it as an older couple. So that'll be good. Do you want to go ahead and give me the link once we go live on YouTube so we can
yes, we are live
get that going? Once Raman Uncle speaks, I'll try going live on the other sites. Yeah. So we are at 2 right now. So if you want to.
I texted you the link. It's time.
Okay.
And we are live on YouTube.
Oh, great. All right.
I'm going to admit
Let me know when I need to start. Welcome everybody to Joy Academy, and in collaboration with Lewa Patidar Samaj of USA, I would like to welcome you all to a very important session on COVID vaccination, remove some of the myths and hear some reality behind why someone should take the COVID vaccine, under what circumstances, what are the side effects of it. Dr. Yogesh Desai is one of our Samaj members who's going to go into detail with this. But at this time, I would like to introduce our President, Nancy Naina Patel, to take over from here to manage and to bring everybody on board, introduce other speakers as well. And thank you for being here. And I would hope and expect that you would share this information with all your near and dear ones. The recording of this will be posted on the YouTube channel of Joy Academy for future reference. Thank you.
Thank you, Raman Uncle, for the introduction on behalf of myself as the LPS of USA President, my fellow officers, Nayan Bhai, Vice President from Nashville, Tennessee, Treasurer Hitesh Patel from Sulphur, Oklahoma, and of course, Girish Gary Patel from Little Rock, Arkansas as our secretary, and then our ex officio and one of our past presidents, Jimmy Patel, from North Carolina, Advanced North Carolina. We and the board of directors, we welcome everyone to this very important session during these difficult times with the global pandemic. As an association, we decided that this was a very important topic, so we wanted to bring this to our membership, and not just to only our membership, to our friends, to our network, maybe other Samajas too. Every day we wake up, we turn on the TV, there's something going on about the coronavirus, especially now that the vaccine's here. We wake up with many questions, many fears, many doubts. And today we are honored, without any further ado, to introduce one of our very own LEVA members, Dr. Yagnesh Desai, who is a MD and a emergency medicine physician at the University of Texas and Health in Tyler, Texas, which is from my neck of the woods, East Texas, my childhood. He's also a medical director for UT, EMS, and Air One Flight Service. He has treated many patients on the front lines since the beginning of the pandemic and has taken care of many COVID patients. So today we want to share his experiences and provide important information regarding the vaccines, because especially our community, there's a lot of myths, of what to do, what not to do, how to, we're always sending information, but the real information comes from these frontliners. And before I turn it over to Dr. Yagnesh Desai, I want to thank him and all the frontliners out there that are daily fighting their lives as they're trying to save lives. We commend you. We thank you. We truly think just as much as God, that you are God for us, and we really appreciate it. So, Dr. Yagnesh, the floor is yours.
Thank you. So before I'd like to get started, are we going to take a couple of experiences from some of our members that have had some firsthand experiences with COVID, or would you like me to go ahead and?
I'd like for you to go ahead, do your
Okay.
presentation, bring their experiences, and then what we're going to do is open it up into a chat with our participants, because our participants also will probably have a lot of questions. So we want to make sure that everybody, once you finish with your presentation, I think there'll be a lot more questions.
Okay, very good. Well, thank you everyone for joining today. As Nancy said, this is a very important topic. There's been lots of myths that have been spread, and it's very important that we understand fact from myth. This has become a very deadly disease over the course of 1 year, and I'm going to share a couple of slides with you to provide a little bit of information. And based off of this information, hopefully it will spur some questions or remind you of things that you may have thought about in the past, but never were able to get an answer for. Okay, can everybody see my screen here?
Yes.
Okay, so I'm going to first start by going over some of the numbers here, and this is going to be focused on just the US. So as of January 14th, we have hit a total number of cases of over 20 million. I just checked prior to this presentation, and we were at 23.6 million cases of COVID-19 here in the United States. The US has become probably one of the largest number of cases throughout the world. It's seen more deaths than any of the other countries have. And there's a lot of argument on, is it because we're testing more? Is it because we report our numbers more? Maybe there's falsehoods in some of the reporting done from other countries. None of it really matters. What matters is these are all folks that have been infected, and we've lost many, many lives because of that. Looking at the daily death toll from this disease, we have topped over 3,000 deaths per day. This is, you can look at this graph and you can see we're hitting higher numbers than we have since March of last year, when COVID really took off here in the US. And we've not done very good at getting this under control. And you can see the number of deaths as well as the number of cases. If I go back to my previous slide, it really started taking off in November of 2020. And this may have something to do with the fact that there are several major holidays that come right around towards the end of November and into December and into January that has probably led to spread and increased infection rates just over the last 3 months. The total number of deaths, this is all the people that have passed away due to COVID since the beginning. We have topped 393,000 deaths as of today. And to give you some perspective of 393,000 deaths, that's a very large number. That's the size of a small city or a large city, depending on where you're at. Compared to Tyler, 393,000, that's a pretty large city. So to give you some idea, here is a comparison of what 393,000 deaths looks like compared to some of the other major tragedies in the history of the US. So at the end of 2020, we were already at 300,000. Just in the beginning of halfway through January, we have added 93,000 more deaths to that 300,000 number. We have already surpassed the combined number of deaths from the Korean War, the Vietnam War, as well as World War I. And we will probably be surpassing the total number of deaths from World War II here in the next 60 days. And if you look at this sheet, you can see all of these wars, these were death totals over the course of 4 years or longer. This is only in the first year of COVID-19. Matter of fact, we haven't even hit the 1-year mark yet, because the first case in the United States was not diagnosed until January 20th. which we have not seen January 20th yet. So we are rapidly losing people to this disease. And if we don't do our part to stop the spread, this will only continue to worsen. So what puts you at higher risk for developing severe illness that puts you at higher risk for death? So there are known conditions that will put you at much higher risk for having a severe illness. And they include cancer, chronic kidney disease, COPD, which is lung disease, chronic lung disease, Down syndrome, heart conditions such as heart failure or coronary artery disease. If you've had stents or if you've had a bypass, you are at higher risk. If you have a weakened immune system because of organ transplant, if you had a kidney transplant or a lung transplant, that puts you at much higher risk. If you're obese, obese is something that many people don't realize, but it's a very strong risk factor for poor outcome with this disease process. Pregnancy, sickle cell disease, smoking, and type 2 diabetes. These are confirmed conditions that put you at a much higher risk for severe illness. Looking at this list, if you think about yourself or family members or friends, some of these conditions are pretty prevalent in our samaj. So this is very important that we pay attention to those that have this disease process. Some of the other conditions that also may put you at higher risk include asthma, stroke, cystic fibrosis, which is a chronic disease of the lung, high blood pressure, weakened immune systems due to medications that you may take, being on steroids, bone marrow transplant, or HIV disease, dementia, liver disease, having scarred lung tissue, or type 1 diabetes. So what can we do to protect ourselves? So I'm going to talk a little bit about the things that we should have been doing up until now, but I'm going to go ahead and talk about the vaccine. And currently there are 2 available vaccines available. There's the Pfizer vaccine and there's the Moderna vaccine. And a little bit about each of these. So the Pfizer vaccine, they're both 2 doses. The Pfizer vaccine is given on day 0 and then again on day 21. And it can be given to patients that are greater than the age of 16 years old. The Moderna vaccine is also a 2-dose vaccination, and it's given on day 0 and day 28. The Moderna vaccine is currently approved to be given to those age greater than 18. There is no age restriction for those older than 65. So if you have elderly parents, if you have grandparents that are older than 65, there is no limitation on how old they can be to receive the vaccine. 80-year-olds can receive it, 90-year-olds can receive it. And that age group tends to have poorer outcomes and higher chances of death. Receiving the vaccine may be in their best interest. As far as younger patients, younger than age 16, there are currently trials underway. Both of these companies, Pfizer and Moderna, are conducting trials for children as young as 12 to determine the efficacy and safety profile for giving to younger patients. So let's talk a little bit. I'm going to explain a little bit about how the virus works, how the vaccine works. And I'm gonna try to keep this as simplified as possible, but it's a unique technology that we're using now, and it's a completely new style of vaccination. So this is a picture of the coronavirus, and you can see the coronavirus has these red spikes on its wall, on its outer layer. These spikes are what really make the coronavirus easy to identify. The spikes are what the virus uses to attach to your body cell, inject its genetic material into your cell, and then produce more viruses inside of your body. And that's what causes this virus to spread in your body. So the way the vaccine works, those spike particles that I mentioned in the previous slide are made up of protein. So what these vaccines have done is they have taken what's called mRNA, and that stands for messenger RNA, and they have isolated messenger RNA, and they've wrapped it in lipid, which is basically fat, okay? And that makes it easier to inject into your body without destroying that little piece of mRNA. Once that mRNA is injected into your body, that little piece of mRNA attaches to your cell, and the mRNA is taken inside of your cell, and then your own cells start creating the spike protein, the same spike protein that's found on the actual virus. The only difference here is that your cells are only making the spike protein, not the actual virus. Once it starts making these spike proteins, it presents these spike proteins on the outside of its cells, as you can see on this slide. Your immune system, your immune cells recognize that this is a foreign body. This spike protein is not supposed to be on this cell. So your immune cells will come and attack that spike protein. And they learn how to attack it, and they learn how to neutralize it. And then your immune system remembers what that spike protein looks like, and it remembers how it needs to attack it and get rid of it. So when you do come into contact with the actual virus, and that spike protein is presented once that virus enters your body immediately recognizes that spike protein as a foreign body, and it will immediately attack it and neutralize the virus before it can spread and start doing damage inside of your body. So when are you eligible to get the vaccine? So the vaccine, each state has developed its own distribution plan. These are the phases that were recommended from the CDC's Advisory Committee on Immunization Practice. And most states are following these guidelines or something along these guidelines. I think most states some are doing exactly this, some are doing a little bit differently. But this is the general distribution plan in which healthcare workers are your first people to get the vaccine, as well as residents and workers in long-term facilities. That should be your nursing homes. Next, they are recommending your advanced age patients. Some states are doing 65 and older, some are doing 75, and frontline essential workers. And next would be 16 and older that have any of those high-risk conditions that I discussed earlier. And then other essential workers that aren't frontline, but are also necessary to keep the economy going. And then the last phase includes all folks that are not in a high risk category. And this is going to be different from state to state. So I'm sure most of you have contacted or have heard on your local news which groups are eligible to be vaccinated. So what do you expect after you've received the vaccine? So I have received both doses of the vaccine, and my personal experience, it was not bad at all. But some of the most common effects that people will experience include fever, chills, pain or swelling to the vaccination site, fatigue and just feeling tired, and then headache. And typically these symptoms are 24 hours or less, and they are easily treated with Tylenol and just rest. So once you have the vaccine, does this mean, great, we're back to normal, I can go ahead and buy those Super Bowl tickets and book my plane to Vegas? No, it does not. And the reason it doesn't, there's several reasons. So the vaccine provides 94 to 95% efficacy against developing severe COVID-19. We don't know yet, because it's so new, if it completely prevents you from getting it. And what I mean by that is, you might not get any symptoms, you might not get any signs of having an infection, but you might still carry the virus and spread it to others. The other thing, full immunity after you've received the vaccine may not take effect until up to 2 weeks after the second dose. And it may take up to 2 weeks before you actually have the 95% efficacy against the vaccine. So after you've gotten the second dose, you definitely don't want to immediately go and do anything that's going to put you at risk of becoming infected. Even after the vaccine, you must continue to wear the mask, social distance, and practice good hygiene until a large percent of the population has been vaccinated, because we don't know if vaccinated individuals may still be able to spread the virus and infect others from it. And then there is always the 5% chance that you may not have achieved effective immunity and you're still at risk. So it doesn't make sense to continue taking risky behaviors even if you've had vaccine until we know we have controlled the virus and its spread. The other importance of vaccination. So by now, I'm sure most of us, all of us, know someone who has been hospitalized with severe illness or has passed away due to COVID-19. It's still a very dangerous disease process. Treatments are being developed, but there's nothing definitive that can be used to completely eradicate the disease once you have it. Most of the treatments that are being used are still in the test phases to determine how effective they truly are. The disease is very unpredictable. COVID-19 can cause severe disease in both young and old. It can cause severe disease in patients that have none of the risk factors that we discussed. And there hasn't been a predictability that's been determined for this disease process. And then the most important thing that people forget about, we don't know what the long-term effects and outcomes that it has on the human body. Does it cause long-term lung scarring? Does it put you at higher risk for developing blood clots? Does it cause nerve damage or damage to parts of your brain that we don't know about yet? Does it cause depression or anxiety symptoms? So there's a lot that yet still has to be known about this disease process. And it's not a good idea to put yourself at risk of becoming infected. Vaccination is also important because we are starting to see mutations of this virus now. There is a UK variant. There's a variant from South Africa. There's a Japanese variant. The UK variant is the most is known about the UK variant. And what they found is that it spreads even more easily than the original virus does. It's not thought to cause more severe disease or higher chances of death. The vaccine still appears to be effective against these variants, but as the virus continues to mutate, the vaccine and the treatments that we're currently using may become ineffective because the virus has completely changed the way it presents itself. And now the vaccine or any of the treatments that we currently find effective are no longer working. So it's important to stop the spread, get vaccinated, and get control of the virus before it mutates to the point where none of our current medications and vaccines work against it. So reducing your risk of getting COVID. Obviously, getting vaccinated is of the utmost importance, but it's also important that we continue to wear a mask, and you wear your mask over your nose and your mouth, not just your mouth, but you wear it over your entire nose and mouth when you're around other people who do not live in your household. And whether you use a disposable mask and you throw it away, or you use a mask that you can wash, it's encouraged to wear either if you are not around your household. It's important when you are out in public or in other places that you keep 6 feet apart from others to protect you from being exposed. You want to avoid crowded areas, which includes your bars, your restaurants, fitness centers, your movie theaters. You want to avoid poorly ventilated spaces that don't offer fresh air being circulated from outdoors. That's gonna keep constant recirculation of viral particles if there's an infected individual there. You want to wash your hands with soap and water for 20 seconds or use hand sanitizer with at least 60% concentration alcohol. You want to avoid touching your eyes, nose, and mouth. Always cover your coughs and sneeze. Clean and disinfect frequently touched surfaces daily. So your tables, desktops, phones, countertops, light switches, keyboards, and then monitor your health. Watch for fever, cough, shortness of breath, aches. Loss of taste or smell has become a very specific marker for COVID infection, and then vomiting and diarrhea, and seek healthcare if you develop any of these symptoms quickly. That is the end of my presentation. Nancy, I'll turn it back over to you.
Sure. Before we get on to the next part of our session, we had a chat question. Which vaccine did you take, the Pfizer or the Moderna?
I was given the Pfizer vaccine. And so many people have asked, well, does it matter? And both vaccines have shown to be very effective and of equal efficacy. So the Moderna vaccine is easier to get because most of your local pharmacies and local clinics will be able to store it. The Pfizer vaccine requires an ultra cold storage, and many of your local pharmacies will not have that easily available. So most of the local pharmacies or your grocery stores that are offering it, it's the Moderna vaccine that may be available.
Okay, we are going to come back to the questions for our participants. I'm seeing some questions come through, but before we begin the actual interaction with our membership and the people that are participating on this session, we want to get some real life experiences from some of our members. And Dr. Yagnesh, if you can help me interject with them as we talk
Sure.
about each topic, because each of them has their own story. And, so that way, a lot of the questions could be answered within that. And then I'll hold my questions till the end, because there's quite a bit of questions from the Samaj side that I'd like to enlighten on. Once everybody shares their experience, we'll have about 4 different people talk about their experiences. One's going to be from one age group. So we're going to start with the main thing first. Let's start with the younger generation. Let's start from the bottom down up. Okay. We have a younger generation right now. It's a total, I should say, a different world for our youngsters. They don't know how to stay contained, right now, because they're so used to going out, going to college, high school and school, college, and all of the public areas where they're used to meeting friends, going to restaurants and meeting up on weekends. So the younger generation is the generation that we really have to focus on, because that's the generation where we can't contain the practices. And so I wanted to bring on Karina Patel. Her parents are, of course, Hitesh and Karuna Patel from Sulphur, Oklahoma, and she's currently a senior at Sulphur High School. And she recently got accepted at Rice University. Congratulations, Karina. Just to note that Karina is right now a COVID patient. Unfortunately, with all the safe practices from school, she ended up contracting the virus. And we really appreciate Karina coming on to share her experience, even though she's not been vaccinated, of course, but she should send out a message to our younger generation. So Karina, without any further ado, I'm going to turn it over to you.
Thank you everyone for just joining us today, and as we hope to bring some light to this COVID pandemic. Thank you, LPS, for giving me this platform to share my experience and hopefully touch and connect with the youth of our society during these unprecedented times. So as it was mentioned, I am currently a COVID patient. I just tested positive recently. I'm 18, just to kind of give a little perspective on that. So I contracted my COVID from the bus. There was somebody on the bus that actually had it. So on the bus, everybody wears their masks. We all sit quiet separately, so there's not really that much close contact. So there's very slim chances of us getting COVID. However, I still happen to get it. Luckily, my symptoms have been mild because I am a very healthy person. I work out, I eat healthy, and I have a good immune system. So fortunately, my symptoms have just been, migraines, lots of fatigue. There's a lot of exhaustion. And then, of course, just losing my sense of smell and taste slowly. As Dr. Desai said, that's one of the biggest symptoms for sure. So that's kind of slowly coming in to roll. I didn't start showing symptoms until day 5 after being exposed. So I think Dr. Desai touched on this earlier. It takes time for your symptoms to start showing. So even if you feel perfectly fine, like I did not think that I would ever have it whenever I found out I was potentially exposed, because I was being so safe, wearing my mask, social distancing, and taking the most care of myself. I didn't think I would have it, but 5 days later, I started waking up to headaches and slowly getting symptoms, and my symptoms just progressed. And I went and tested day 6. Which is recommended, usually like 5 days. Doctors say after 5 days, you can go get tested because in that period of time, there is potentially enough virus in your body to come back positive. So I went and got tested this past Monday, and my test came back positive. And so here I am. But luckily, like I said, my symptoms have been mild, but that's not the case for everyone. Fortunately for the younger generation, we are healthy people, but there are people in our household that aren't. I live with a family of 4, so my parents and my younger brother, and my parents actually are diabetic and have high blood pressure, so they are at a higher risk than the common people. And then my brother is young, he's only 10, so his immune system is not as strong either. So although it might not affect me to that extent, it could affect them. And so I think as the younger generation, we sometimes forget that, yes, we can recover, we can get it and recover, but there are people that are living right in our households that can't. And it's important that we are active and we take charge and we take care of them. I could never forgive myself if I got that and gave it to one of my parents or gave it to somebody around me who unfortunately couldn't make it through. Like, I can't live with that guilt. And I think sometimes we forget the long-lasting effects that this virus can have on family members. Like Dr. Desai said, over 393,000 deaths. That's that many families that have lost a brother, sister, parent, aunt, uncle, grandparent, son, daughter. That's a lot of families that have been affected. And so it's really important that as youngsters, we are the people that can help contain this, because our elders are staying in, they're doing what needs to be done. They're staying at home, they're taking the proper precautions. But I know it's hard being a youngster, being a senior. My senior year has been completely blown. It's not the same. And I really am trying to stay positive for the ones around me and really hoping that this can get better so that we all, as the youth, can have a better future. A lot of us are going into college, and the next few years are really important years, and there's a lot that's going to be happening in our lives. And I want to experience that as well, as I'm sure you guys do too. So just to the youth, be active and take care of not just yourself, but those around you, and really double think all of your actions before you do. And the biggest thing is being patient with it, and being active about it. Whenever I found out that I was exposed, which was 2 weeks ago, or almost 2 weeks ago, it was like a Wednesday before. And immediately I came home and self-quarantined, although I didn't have any symptoms or anything like that. I had just been told I was exposed, and I decided to immediately self-quarantine from my family because I didn't want anybody else to get it. So I came to my room and locked myself in until the 6th day when I went and got tested. And then I still came back stayed in my room. Currently day 12 of being in quarantine, and it's not easy, but it's worth it to save your family, and that's the most important thing. So just be patient, be active, and take care of those around you who can't take care of themselves. So
that's very well said, Karina, and you made some very enlightening points. This disease is, you have to be very selfless if you really want to get some control over this disease. Younger folks that don't have many medical problems, sure, they may not be as fearful to become infected. They, don't want to completely change their lifestyle that they've gotten used to for, well, their whole life. And well, they don't have much to be worried about because younger folks or folks that don't have many medical problems do okay. But just know, just because you get sick and you survive doesn't mean somebody that you spread it to would. Many of us, if we were involved in a car wreck and we killed someone that was involved in the other vehicle, we would feel very badly, and there would be probably a life's worth of guilt. This is the same thing. You may not realize it because, well, you don't exactly see that you gave it to someone. But, if you potentially were to infect someone in your own household, that would be very devastating. So that's a really good perspective you've got there.
Yes,
Thank you.
Karina, thank you so much. That was really enlightening, and I hope the youth in your age category does understand this. And we still, like Dr. Yagner said, that we still have to continue to do safe practicing. This is not over yet. This is just the beginning, it seems like. So now we got that perspective from Karina. Jimmy. Jimmy is one of my fellow officers and past president. When he ended his term, the last few months, fortunately, is where the beginning came. And with Jimmy, we want to say a moderate age group from mid-30s. We'd like to say we're younger, but mid-30s onwards to 50s. That is another mid-young generation that really needs to pay attention because, they're still gathering up and having parties in couples, whether it's weddings or funerals or any just holiday season gathering. They're thinking, oh, it's okay, the vaccine's coming out or whatever. Jimmy, being in that perspective, because we're in that age group, can you enlighten us on that? And plus, you have parents at home too. And, I know that your father got vaccinated and your mother hasn't qualified. Can you share some of that perspective from our age group where people are doing so many gatherings still, and then your parents being home too, and then your father being vaccinated?
Oh yeah, the pandemic and all that, it began sort of halfway through my term. So we started to learn more and more about the impacts of the virus and how it can impact people who is the most susceptible to, potentially catching this, and it could be fatal in many cases. And so it was a large learning curve for everybody, including the medical community, as well as us as a community, and learning, what to do. You heard about the washing your hands, and you heard about 6-foot distance, things we never heard before. We never heard of social distancing until this particular virus happened. It took 100 years since the last one, as far as I know. But I think in terms of the age group, from the 30s to where I'm 50, in the low 50s now, I think we're the ones that need to be careful that we don't catch the virus and then give it to our parents or give it to any elderly folks that are staying with us or whatever the case is. Many of us have extended families, and I think that's also different in our community. I think the Hispanic community is like that, but the majority of the rest of the American folks, they don't have extended families. So Karina pointed out her parents, but if her parents were here from India, they would be staying with them. And so it's really critical that we're cognizant of making sure we follow all the steps to make sure we don't get the virus. Because if we do, there's a greater potential of you spreading that to your parents or the elderly folks in your family. And you know, most of us, well, I can't say most of us, many of us are diabetic, as the doctor pointed out, and you guys all know that. We all have a lot of high blood pressure within our community. So we are further at risk. Obviously, a lot of us were obese. We try to do what we can.
Yeah.
But, you know, that is sort of key within our community. We fall in a lot of these high risk factors. And then on top of that, we have extended families. And so it is really important for us to be careful, do what we can. I remember though, during, I guess it was in the summertime, you know, things are progressing, meaning the research and all those things were progressing in terms of getting more understanding about the virus. But still, I know people within our community, some mostly within our same age group. I mean, they're getting together every week or two. As we got further into the summer, they were having a picnic every 2 to 3 weeks, where you would have anywhere from 15 to even 30 people, different age ranges. But, you know, I remember one time one of the guys actually even brought their parents. I attended 1 or 2 of these. You try to keep your distance from people. Obviously, it's outside, it's a picnic, but it is, so it was concerning because you're like, okay, if I get something, I'm going to take it home. And my parents have the potential to get it. But then also in our business, you know, think about it. We're going to our business. You're actually operating the business. You're there all the time. Many of our community, same way. I mean, some of the officers, I think most all of our officers go to their businesses or are actually working at the business. So now you created that other avenue where you're susceptible to catching the disease. You know, people coming in a hotel, you don't know who they are. Yeah, you don't know where they've been. And there's a potential, even though you practice the safe practices, that somehow you can still get it. Karina pointed that out too. You know, then the bus, they're in a small sort of, I mean, it's a small area that you're confined to. And even with the social distancing, she still got the virus. So similar, like where we're running our hotel front desk or we're interacting with our staff, we don't know where they've been. And they say, you know, have they caught it? And they don't even know if they have it because so many people are carrying the virus and not even aware of it. So there's a lot of different things that we're dealing with. Going back to the main question, I think you asked me was within our age group, I think we're the ones that are most likely to get something just because of the daily activities that we do.
Right.
And I don't think, I mean, we're not in the business where we can shut ourselves off and work from home because that doesn't work. Most of us are in the hotel business. Most of us, or many of us are in the restaurant business or other types of businesses where we're interacting with, if it's not the actual guest or the customer, our team members who could be exposed to these things. So a lot of different factors. My parents, we've been looking to try to see when they would qualify. What I will say is that has not been a simple process. I mean, we had to really try to find out when, for instance, my dad could get a shot, and he had to go in another county, which we have a business in, where he qualified because he's over 75. And my mom, she's 73, but she hasn't qualified yet. And so in our county where we live, it's a smaller county and they haven't got the virus doses or the vaccine doses rather. But then Forsyth County, which is a larger county, and Guilford County, which is half an hour from us, 65-year-olds within our community have already received the vaccine first shot. So it varies how the distribution is happening. What I can tell you from my dad, where he got the first shot, I think it was last week, his arm hurt for a little while. You know, he had a little bit of pain related to that, but fortunately nothing else. So, you know, hopefully most people don't, get the symptoms. Well, one question I did have related to that, and it's for the doctor, is that I have heard of, and actually someone within our family on my wife's side, he's a doctor. He's a new doctor. He has been working with COVID patients. He's in Florida. And when he got the first dose of the vaccine, within a few days, he got sick and he actually contracted the disease. And so then he was isolating himself. So you kind of wonder, is this related to the vaccine, or was it just a coincidence that, you know, he may have been around people, or maybe he let his guard down because he's like, okay, I got the first shot, I should be okay. these are things that you worry about. You also heard about, not within our community, but there was a doctor somewhere that allegedly he got the shot and he got the disease, and then within a few days he passed away. So you don't know. I mean, again, it's all a lot of gray area. I don't know the actual facts, but these are things that are concerning and spreading within the community. And then you've got those that are afraid to take it, getting more afraid that, oh, what if it happens to me? So I don't know how you address that. So that's one of my questions to you.
Okay. Thank you, Jimmy, for enlightening us on your views, and absolutely within our age group. Dr. Yagnesh will answer your question, but added to that, Dr. Yagnesh, is that, like Jimmy pointed out, that apawara je amari age group mache, they just are not taking it seriously. They're still going to sporting events, whether it's volleyball, playing cards, getting together, those kind of events are happening daily. They just can't stay home anymore. And Jimmy brought up some great points about business. I mean, over 50% of our community are staying in the businesses. Not everybody's in a house. I have my house within my hotel. So we're daily, like Jimmy said, we can contract it from there. So if you can enlighten us on that too a little bit, I mean, that's huge. And as Jimmy asked on some questions, another question as you address Jimmy's is also, we do touch a lot on type 2 diabetes, but there's some people that have type 1. So if you can touch on that a little bit in this section.
Sure. So the one thing I want to say, because, within our samaj and our customs and traditions, it's okay to say no. It's okay to say no. If you get invited somewhere and you don't feel it's a comfortable environment or a safe environment for you to be in, whether it's a wedding, a birthday party, or just a get together, it's okay to say no. And the same thing, if you're not invited to a particular event, you don't need to take offense to it. Okay, it's probably safer for you to not go anyway. So I think, we also have to change our mindset that, hey, it's okay if I didn't get invited, it's probably safer. And hey, even if I did get invited, I don't think I want to go. And it's okay to not invite somebody, or if somebody's wanting to come over, it's okay to tell them, hey, look, we're trying to keep safe. I've got diabetes, or I'm obese, or I'm worried. I would rather connect with you over FaceTime or over Zoom, or, hey, you know what? You can pull into my driveway and I'll come outside and I'll put a chair in my front yard and you can stay in your car, or you can stay in your, 6 or 10 feet away, and we can meet in that manner. But it's okay to change our normal customs and habits to be safe and to keep ourselves protected. To touch on Jimmy's question regarding vaccine and contract, that's a great question, and a lot of people have that. So it goes back to what I presented. So this vaccine is very unique in that you actually are not getting any virus or viral particle injected into you. Even after getting vaccine, even after getting the second dose, unless you've actually had COVID, if you were to go and get tested, you would not test positive for COVID because you were not given the actual virus. You were only given instructions on how to make a spike protein. And the spike protein is not the actual virus. So folks that have gotten vaccinated and ended up contracting it, particularly after their first dose, in which you don't have full immunity, you were probably exposed to it roughly 7 to 10 days before getting your vaccine. And then roughly there's a 7-day period after exposure in which symptoms will start to develop. And then I think Karina was even saying she got tested on day 6. So after having an exposure, it can take up to 7 to 10 days before you'll get symptomatic enough to where you're going to go get tested and get worried about it. So it was likely an exposure before receiving the vaccination. I think there was a question regarding diabetes. So diabetes puts you at higher risk for many things, but type 2 as well as type 1 are thought to put you at higher risk for severe illness. So if you're diabetic, you really want to be careful and take extra precautions to keep yourself protected and safe. Was there, I don't, Jimmy, did you have another part of your question that I didn't get to? Or was there something else?
No,
Okay.
one of the things I was pointing out was how, I don't know if it's a coincidence where you hear about people getting it and then actually having drastic results from it. Based on the research, that's not supposed to be the case based on what you've said. So I don't know what the correlation is or how you'd explain that to anybody.
Yeah, as far as, side effects from the virus?
Yes.
Or from the vaccine, I'm sorry?
Right, from the vaccine.
Yeah, so, everyone is going to be different. So the folks that I work with, a majority of the folks that I work with, we had a running joke. Did we even actually get the vaccine, or was it just some water? Because none of us felt anything, especially after the second one. After the first one, we all had some arm soreness. Some of us had some chills. Some of us felt a little tired, but nobody got really sick. And you're not supposed to get, deathly ill or have to be hospitalized or anything. So these are normal things that should happen when you have chills, when you have these aches, when you're having a fever. That's your sign that, okay, my immune system is actually responding, and it's creating a protective effect. It's recognizing a foreign body inside of me, and it's mounting immune cells to attack this foreign body. And that's why, if you develop these symptoms, that's a good thing. That's showing that, hey, my immune system is recognizing this and it's working.
Dr. Dessa, I had another question as we were this. Jimmy had maybe pointed it out, but it was about the rollout. So vaccines are coming, but they're coming slow. But how is that? How is it that they're not even having underlying health conditions? They feel like they're running to the door and like, we're going to be safe now that we took it. What is your perspective on that, and how should we manage that? Because we have a lot of frontliners, a lot of people that are on the underlying health condition that needs to go first, right? 65 and above, and the health conditions. And as soon as they hear it, we have it here in Corpus right now. We had 5,000 vaccines, but they were just shooting out to everybody. So how do we control that? Because we really, really need to have a proper rollout.
Yeah, it's important to be responsible. So if you are not in a high risk category, we have many people, even in our own Samaj, that are very high risk, and they're having difficulty getting vaccinated because we have folks that aren't front in line jumping in and getting it and receiving it. And you have to remember, the vaccine is still being manufactured. So as states get shipments, they distribute it. But obviously there's a big demand for it. So the distribution runs short oftentimes. And so states are struggling with it. Some states are, there will be some vaccination centers where they're going to be like, hey, I've got 3,000 doses and I want to get it out to as many people as I can. And they may be a little less strict on following the guidelines. There are other, and I think Jimmy touched on this in his own county, where they were not going to give it because North Carolina, their phase out was a little bit different. So every state is different. And what you're going to find in anything, the vaccination centers are going to be different too. Some are going to be willing to give it to anybody that walks up without checking or asking any questions. And some are going to be like, nope, I'm going to go by the book. We're in phase 1B. That means only healthcare workers. That means only those over 65 or those that have a condition that puts them at risk. And some are going to be like, yeah, sure, we have a couple extra doses. We'll hook you up, So, if it's available and they're willing to give it, then people are going to go and get it, But it's important that, if you do find a vaccination facility or center that has a vaccine available, that you inform and let those that are high risk know so they can definitely go and get their dose.
Like the seniors, yeah. Now with some questions on some, like Karina is tested positive. When is a chance for her to go take the vaccine? Because she's she's already in the COVID mode. And then
Yeah.
also when you're taking the vaccine, there's a lot of myth about ibuprofen and Tylenol. Some say take Tylenol, some say take ibuprofen, vice versa. Can you enlighten on those two parts right there?
Yeah, sure. So if you've actually been infected, or if you're currently infected, the recommendation is to wait until you have completely recovered and you are no longer having to quarantine. So that's going to be 14 days for most people, depending on if you work or whatever. Sometimes they have different policies as well. But it's going to be, you are eligible to become vaccinated as soon as you are completely recovered. Now, that being said, what they're seeing is most people, after they've actually had the infection, they don't seem to be at risk for getting infected again for up to 90 days. So it would be fair to wait 90 days before you go and get the vaccine. So that way you have 90 days of immunity just from the actual infection, and then you can go ahead and extend your immunity after you've gotten the vaccine. Because currently we don't know how long immunity lasts, whether you had COVID or you got the vaccine. And the reason we don't know that is because, like I said, we just have not had enough time with the disease. We have not even hit the 1-year mark. And so no one is going to take the chance of, hey, I got the vaccine. Sure, I'll sign up to go test to see if I can get infected. No one wants to take that chance, and no one, after 6 months after you've had the vaccine and they're like, hey, who wants to volunteer to get in to see if you get infected? Nobody wants to take that chance. So it's a very difficult thing to figure out. And we just haven't had the vaccine rolled out long enough to know how long is the immunity going to last from it.
And that you can also maybe get it again, right?
Yes.
And again, with the ibuprofen and the
yes.
Tylenol.
So there, Tylenol is recommended. However, if you're not feeling anything, so after my first vaccine, I had a little arm soreness. So I went ahead and took Tylenol. But after the second one, I didn't take anything because the arm soreness wasn't that bad. So it's not necessary to absolutely take it. I would recommend it after the first dose, just so you don't suffer too badly if you do react very, very drastically to it. But if the Tylenol is not relieving your symptoms, then it's absolutely okay to take ibuprofen or Advil. But Tylenol they kind of like Tylenol a little better than ibuprofen for whatever reason.
And one more question before we move on to the next experience. We have the second virus that is the UK virus variant that we have, and who knows, there could be furthermore viruses out of this virus. Do you know if these two vaccines are going to be working against those viruses?
Yeah. Damn Brits, always trying to invade the US, but
I'm British too.
Yeah, I figured. So as of now, they are finding they do feel the vaccine is effective against the UK variant. And even the treatments that we're giving in the hospital to those that get severely ill, they do feel the treatments currently do work against the UK variant. As we see more variants, as we see more mutations, that may change. So that's why we want to try to tamp this thing down before it mutates into something that, once again, it's uncontrollable.
Right. And recently, Dr. Fauci has said that this second variant is kind of more deadlier than the first one.
Well, it spreads more easily,
Yeah,
right? So the original virus, if one person walked in a room and had the original coronavirus, he might infect 10 people. This UK variant, you might walk in the room and he could infect easily 20 people. So it spreads much easier. And of course, it's a numbers game. If you're spreading to a lot more people and more people are getting infected, naturally, you're going to increase the chances of more people dying or getting severe illness from it.
Thank you. So now our next experience is going to be with, of course, our one and only Bipin Kaka. Bawaji is what he's known as. I want to thank him first humbly for bringing you as the resource for when I picked up the phone and said, we want to do this session. And he says, no problem. I have somebody in mind. Let me see his schedule. And so because of him, we're glad to have you as our resource today. Bipin Kaka has served on LPS of USA before, and he's a past board of director. And today in his retirement, he's impacting a lot of positive lives by doing the charity work for Babaji Charities back home in India. So I would like to welcome Bipin Kaka to share his experience too. Go ahead, Bipin Kaka.
First of all, Jai Shri Krishna, everyone. Thank you, LPS USA, for bringing this program today. It's a wonderful experience that we community will have all together today, presented by Yagnesh Desai. અમે લોકોએ પણ ગયા શનિવારે COVID-19 ના શોટ મારી બા અને મારી ધર્મપત્ની કુસુમબેન સાથે લાઈનમાં 5 કલાક ઉભા રહીને અમારો નંબર લાગી ગયો અને અમે ઇન્જેક્શન લીધું. મારી બાની ઉંમર 87 વર્ષની છે અને હું બાને જ વાત કરવા દેમ કે બા તને શું અનુભવ થયો આપણે શોટ લીધો તેમાં? તને કઈ થયું?
મને કઈ થયું નથી તાવ આવ્યો પણ બીજા દિવસે જરાક હાથ દુખેલો ઊંચો નીચો કરે તો બાકી બીજું કઈ તકલીફ નથી પડી.
બતાવી લેવો જોઈએ. સરસ. જો બાના અનુભવ પ્રમાણે 87 વર્ષની ઉંમરે આ COVID-19 અમને લીધા પછી બાને કોઈ જાતનું સિમ્પટમ્સ નથી. ઘણા આપણા પરિવારો અમેરિકાની અંદર મા બાપ સાથે રહે છે અને ઘણા લોકોને એવો પણ વિચાર કદાચ આવે કે આપણે ઇન્જેક્શન લઈ લઈએ અને બાને ઉંમર થયેલી છે 85-90 વર્ષના થયા એને શા માટે આપણે તકલીફ આપીએ? આપણે બે લીધા એટલે આપણું ઘર સેફ થશે, બાહો સેફ રહે. આઈ થિંક વી શુડ નોટ ઇવન થિંક એન્ડ કન્સિડર કે ભાઈ આપણે ચાલશે. હું બધાને હમ્બલ રિક્વેસ્ટ કરું કે ઘરના જેટલા વ્યક્તિઓ હોય ઉંમરની કોઈ બાધા રાખતા નહીં, બધા જ COVID-19 ના ઇન્જેક્શન અવેલેબલ થાય એટલે લેજો અને એની કોઈ ફિયર રાખવી નહીં કે બાના અનુભવ પ્રમાણે મેં જોયું કે વડીલોને કંઈ કદાચ કોઈને કોમ્પ્લિકેશન આવે, બહુ કદાચ તાવ આવે અથવા કદાચ આવે તો માથું દુખે, પણ ઘરડા માણસોને પણ આપણા પરિવારે એ લોકોને પણ પ્રોટેક્શન કરજો. અને જે પ્રમાણે નો કહેતા જે વાત કરીને તો ડેલાસની અંદર બાવાજીની ઇમ્પ્રેશન એવી છે કે બાવો કોઈતા જાય નહીં અને કોઈને બોલાવે નહીં. આવા મારા ફ્રેન્ડશિપ ગ્રુપની અંદર છે તો એ લોકો મિંગલિંગ થાય, ભેગા થાય, પણ બાવાજીને બોલાવે નહીં. એટલે પછી મને કહે બાવાજી તું કેમ નહીં આવે? મેં કહું બાવાજી પોઝિટિવ છે એટલે મારે કોઈને આપવું નથી અને બાવાજીએ આખી જિંદગી જ પોઝિટિવ રહેવું છે કે હું પોઝિટિવ એટીટ્યુડ વાળો છું, જેથી કરીને આપણા ઘરે ના કહેતા જે શીખો બાવાજીએ ડેલાસની અંદર ના કહેતા શીખવું. અને ઘણા જે ડેલાસ કમ્યુનિટીમાં સાંભળતા હોય એમને ખબર હશે કે બાવાજી કોઈતા જાય નહીં અને બાવાજી કોઈને બોલાવે નહીં. મળવું હોય તો આપણો બેકયાર્ડ છે અથવા પાર્કિંગ લોટ છે, મળીએ, આનંદ કરો, વાત કરો, અડધો કલાક ખુરશી બેસીને શાંતિથી. પણ હજુ પણ આ COVID-19 ના લીધા પછી પણ આપણે આ સેફટી રાખવાની જરૂર છે. અને જે ભાઈઓએ અને બહેનોએ જે શોટ લીધા તો આપણને આવું ફોર્મ આપવામાં આવેલું અને એને ફોર્મને તમારે એને રિસ્પોન્સ કરવાનું. એમાં વી સેફ કરીને લિંક છે, એની અંદર તમે જે કોઈ COVID-19 શોટ લઈ એ મહેરબાની કરીને એ લિંકની અંદર જજો અને તમને એ લોકો ક્વેશ્ચન પૂછે કે 2 દિવસ પૂછશે તમને કે તમને કંઈ થયું, તમને હેડેક આવી, તાવ આવ્યો. એટલે they are trying to collect some data from the people who got COVID, right? The CDC is collecting all this information, so maybe in the future they can do a better job by and what symptoms majority people had and what can happen or what can they can bring it maybe to the next level. આ વાયરસ ઇન્જેક્શનથી જતો નથી. જે પ્રમાણે ડોક્ટરે કહ્યું કે આપણામાં પ્રોટીન ડેવલપ કરીને ફાઇટ કરે, આ કાયમી રહેવાનો છે. આ COVID-19 કાયમ રહેવાનો છે કે એ જે એરમાં છે એની કોઈ દવા નથી. જેથી કરીને આપણે કાયમ આપણું સેફટી રાખવાની જરૂર છે. હું એવું માનું કે 70 થી 80% આ અમેરિકાની અંદર COVID-19ના કેસીસો ડાઉન થઈ જાય પછી કદાચ આપણે થોડુંક રિલેક્સ કરીએ અને થોડુંક મિંગલિંગ કરીએ તો સારું. ત્યાં સુધી આપણે તકેદારી રાખવી જોઈએ અને એકબીજાની માટે સેફટી રાખજો, ડિસ્ટન્સ રાખજો. એ જ મારી તમને ખૂબ અંતરથી પ્રાર્થના. જય શ્રી કૃષ્ણ.
Thank you, Bipin Kaka. As always, તમે તો કીધું કે વાયરસ જવાનો નથી હમણાં તો તમાથી તમને મળવા નથી આવવાનું. બા, જય શ્રી કૃષ્ણ. Thank you. બા બરાબર કકડા દેખાડા છે. અમારી કરતા બી કકડા લાગતા છે બા તો. Doctor, would you like to enlighten on that a little?
Yeah, so absolutely. Don't have hesitation due to elderly age to resist, because here's the thing. You know, if you're elderly, you have a high risk of having severe illness. And what I tell people that are, well, I'm worried about the vaccine. Is it safe? Is it that? I would much rather take my chances with the vaccine than the actual virus. And I'm a healthy person. I don't have any of the high risk factors, but the virus itself is so unpredictable. I've seen some of my paramedics in their 20s in the ICU, struggling to breathe and praying, hoping that they make it because they weren't sure at the time. Beforehand, they thought everything was great. And then when they actually got hit with the virus and they got severe illness and they're in the ICU and they're alone, they're by themselves, their wife is not there, the kids are not there, the parents are not there, there's no family around you. No one is allowed in there. You're not even allowed to touch another human being because all the nurses and doctors that come in there are covered head to toe. And if you start thinking about, is this how I'm going to go out? That's a very scary and very sad place to be. And a lot of these younger folks that have been in that situation afterwards, they recovered, thankfully, but it completely changed their mind and how they thought about it. And, you know, you're young, it's bad enough, but even being old and in that situation, that's still a very, very sad and depressing situation to be in. That you really don't want to put yourself in that situation.
So, Doctor, resonating off of what you just said, આપણા સમાજમાં કહેવામાં એવું આવે કે make a choice. The choice is either be contained in the happiness of your home with your family, where at least you could see them and talk to them. ભલે આપણે બીજા બધાને નહીં મળી શકીએ, like Vipin Kaka said, but at least આપણી family તો છે ને ઘરે. Or would they take a choice કે ચાલો અમે બહાર ગઈને, you know, just frivolously go out and party or go to a gathering and take the risk and say, let me go into the hospital and maybe that might be my last breath where I cannot even see my family, my kids, my parents, or my wife or husband, and take that chance. So which do you pick? So that's what I'm getting, because you see it every day.
Yeah. And, you know, people try to stay upbeat, but I know a physician that was healthy, no medical problems. He contracted COVID-19, and in 2 weeks, he was gone. He was gone. 4 kids behind, wife and 4 kids. And he had no high risk factors or anything. So it's a highly unpredictable virus. And taking your chances with the vaccine, probably much better safety profile than taking your chances with the virus, in which it's a proven killer.
Right. And still continue to practice safe CDC guidelines even after the vaccine, because we all still need to get vaccinated in order for everything to work.
Right.
That's a message that should resonate to all of our members and all the viewers that will watch this session also. So now moving along, we'd like to invite, I call them the dynamic duo couple. They are from Dallas, Texas, Surakanti and Chananko. They've been gracious sponsors of our LPS of USA in the past, too. Great members also of LPS of USA. And personally, as community members, you know, we'd like to get some experience, highlights of COVID-19 with them. So The floor is yours, Surakakaki and Chandrakandanko.
Okay. I would like to share a different kind of experience that we both went through. It happened 2 months ago, sometime in November, and we both contracted COVID-19. And of course, I'm an old man, so, 76 years old, very bad background, type 2 diabetes since last 25 plus years, a couple of heart attacks 38 years ago. So very high risk patient. Anyway, as soon as we tested positive, of course, the reason Surekha got was probably because of me, but she's a other extreme, meaning a very healthy person. But since we live together, we both got it. Anyway, so because I was very high risk, I sought immediate treatment from one of the nearby hospitals, and they administered monoclonal antibodies on me. And there are two companies which manufacture these two. Now, when I got it, I think it was just approved for EUA, Emergency Use Authority, by FDA. The one I got was from Eli Lilly. The name of the monoclone is very funny, Bemblani Vimam, something like that. It is given intravenously, and it is a similar treatment that President Trump got, except that he received monoclones manufactured by Regeneron. So there are two companies which make it. Both are administered intravenously. Now, in my case, in our case, we were both asymptomatic, meaning we had no fever or nothing. Only thing we felt was, at least I felt that I was not 100%. And then the day before, we were watching a football game together with 4 or 5 couples, and one of them had contracted. So I said, look, let me go and check it out. And of course, we both tested positive. So immediately I called the hospital, and they did not admit me, but they put us in a separate room, and we went through a 6-hour process whereby they withdrew a bunch of vials of blood from both of us, and then did some plasma treatment. I don't know what it is, but then they administered these monoclones intravenously, drip by drip, and it took us another hour and a half or so. But that really worked. So within 2 days, I was back like Trump. He also recovered in 2 days, and we both did too. So the message I want to give to people who are high risk, they should, as soon as they test positive, they must try to get this treatment. Of course, there are some conditions under which they will give us. In other words, you should get this treatment before you are put on oxygen or you are hospitalized. So if either one of these has happened, then they probably wouldn't give it to you. But if you are a high risk patient like I am, and if you are over 65, and if you go immediately as soon as you test positive, this is the best treatment. And I'll tell you, I'm so thankful to this hospital who administered it to both of us. So my message is, if you are a high risk patient, go to some hospital, try to get this antibody treatment, and that really works. So other than that, I think we enjoyed the whole presentation. I want to thank Dr. Desai. It was a very good presentation, I think very informative for all of us. And I hope people watch it on YouTube after it's all over. And it will be good put to So have it in our LPS library. I think everybody can watch it.
Yes.
Okay.
Sureka,
you want to say something?
something from the
Yes, like Chandrakant said, Dr. Desai, I mean, he's great. All the information that we need, he provided. And now it is in our hand to apply it with CDC guideline and everything. But as Chandrakant said, we both were asymptomatic. Within 2 days, I mean, couple of days, we lost the taste and smell. But other than that, but this virus is so contagious that we were 6 or 8 people. And my daughter-in-law, she just came there to drop me fafda box. You know what? The next day, she had all kind of symptoms, and she was positive, COVID-19. And it was difficult because she had 3 kids, and my son took care of 3 of them while Seema was in quarantine, because no school, nothing. And we can't help them either. So it is difficult for younger generation. If, out of a couple, if one got it, and then the rest of the family, the kids, the husband or wife, they suffer really bad because 14 days of quarantine, it's not easy. So I hope by watching this, our presentation, people will get good messages, and I hope they follow it. We also got the vaccine. But, as Bipin Babaji said, that center, I think our all SLPS, I think majority, maybe about 300, 350 members got the vaccination. And as Dr. Desai said, they said here, first come, first serve. They didn't kind of separated the health workers or nobody. So everybody stay in line, and we have got the first dosage. And the second one is after 3 weeks.
4 weeks.
4 weeks, yes.
We got the Moderna. And now I'm told that there is another vaccine coming up by Johnson & Johnson that is not going to require 2 shots, only 1 shot. So that will be the third one. That's what I'm told.
So we'll ask Dr. Yagnesh on that one. Surakanti brought up a very good point. This is so contagious. Ek jan ne lage to ako family ne lagi jaye. And a lot of us, Surakanti, are working in our businesses, in our hotels or other businesses. Ek jan ne thai to if we go down, where the foundation of the business or the house, all of us go down. Look what happens just for a few hours of pleasure to go outside and have satisfaction. We can have months and years of distraction at home. What's going to happen? So you brought up a great point. It could affect the entire family and we could all come down. So what happens, right? So great point. So Dr. Desai, if you could go ahead and enlighten on some of the things that Chandrakant went over.
Yeah, and so, they did a very smart thing. Immediately on knowing they'd come in contact with potential COVID-19 and they developed symptoms, they immediately seeked healthcare. And the treatment they referred to, bamlanivimab, it's a monoclonal antibody that was just released recently. And it's used for patients that are high risk. They're not requiring hospitalization, but they might be at higher risk for having severe illness, which might lead to hospitalization later. Treatment with this medication in the very early phases before it becomes severe, it can really make a difference. And so, and there's proof right there that it obviously made a big difference for them. But you have to seek care immediately to be eligible. If you wait till you're too sick, or you're requiring hospitalization, there's other treatments that are given in the hospital setting, but you hopefully don't make it that far, because that's when things can become very unpredictable on outcomes. So you want to, if you think you've been exposed, if you think you might have it, get tested. The test is very widely available now. And one of the big things that everybody talks about before they even experience cough or shortness of breath is that loss of taste and smell. So you wake up one morning and you take a sip of your chai and it tastes like there ain't no sugar in it, unless you're diabetic. You need to go get tested. You know, a lot of people in my workspace, they call me and they're like, hey, I took a sip of my coffee. If you're a coffee drinker, coffee is a very distinct flavor. If you don't taste your coffee or your chai, then there's a potential likelihood that you may have COVID-19 and you better get tested.
Yeah, I have one point. When we went to the hospital, they said that this is experimental, and they said whether we are giving you placebo or actual antibody, they even don't know. So, but the next day, the nurse came, and when she saw us, she said that definitely you got antibody. But nowadays, you know, you have to follow their rules and regulation, because I think the nurses came for about 4 or 5 times. She took the blood and then, you know, sent it to the center or wherever. But the last time when she came, she said that now, if you have a COVID, if you go there within a day or two to the hospital for this treatment, definitely they are giving antibody. There is no placebo.
Right. Yeah.
So
it was experimental, and most of these treatments in the beginning have been experimental, but as they found, okay, they seem to be providing benefit. It doesn't seem to have a large number of, you know, side effects or bad reactions, and this looks like this might be helpful. That's when they will try to put it into play. So in the beginning, there was a lot of people were talking about hydroxychloroquine. And, you know, they were using it. They tried to use it. And some people did get some benefit from it. But what they found, a lot of people had really bad reactions to it. And one of the studies that they were doing, they had several people that died because hydroxychloroquine can cause heart arrhythmias. And it put these people into irregular heart rhythms, and they started seeing people dying, and they had to stop the study immediately because it was not safe. Yeah. So, you know, it's a learning process still. This disease is still in its infancy, and there's so much we still have to learn about treating it, the vaccinating process, and what does the disease actually do to your body even after you've recovered. What does it continue to do to your body? Everybody's had chicken pox, and you know, you recover from chicken pox when you have it as a child and you don't feel anything. But 50 years down the road, when you get shingles, boy, for those that have had shingles, that's not a very fun experience. So, you know, you don't know if this virus, is it going to do something like that where, hey, everything goes away and then 30 years down the road, you have some terrible reemergence, or, you know, does it continue causing some kind of problem? These are all things that are still yet to be known. And, you know, you don't really want to take chances if it's not doing good things to you in the beginning. It definitely may not do good things to you in the after.
Okay, well, thank you so much for all those experiences. I want to take some questions from some of our participants who've been waiting patiently to get answered, and then we'll come back with whatever to end the session with the closing. Definitely everybody ran to and tried to get that medication, thinking that they were going to be safe with that medication, and then it kind of backfired, like you said.
Yeah.
WhatsApp or message ave, but you know, we need to really consult a physician and not become a physician ourselves, because nobody knows. And I think we need to really pay attention to the CDC guidelines, and everything's new to everyone. So that's one thing we do need to resonate to all of our Samaj members. The first question I got, I think you already answered that. You said you took the Moderna, right? As a vaccine.
The Pfizer. I was given the Pfizer.
So that one was one of them. So they said that both vaccines are B-cell vaccines, and that the B-cell do not store information that long. So once I take this vaccine, do I need to take it again after a year or so?
That's to be determined. You know, we don't know what the immunity length will be. Is it a permanent immunity? Is it kind of like the flu vaccine where, okay, we're going to have to change it? So we don't know how long the immunity will last from these vaccines yet, because they've literally only been given for the last month. And the test phases that they did, they're still following the near 74,000 people that they tested on to determine how long does immunity last. The other thing about the vaccine is, as I said before, if the virus were to mutate, then it may require a completely different vaccine that we have to take in order to fight the mutated virus. So yet to be determined.
Okay, thank you for that. Is it safe to take the vaccine for someone having cardiomyopathy, high blood pressure, and thyroid problem?
Yes. You know, cardiomyopathy, high blood pressure, that puts you in a higher risk category. And the thought is, take your chance with the vaccine, not with the virus. With you have high risk factors for severe illness, there's a very, very likely chance that you could potentially end up with severe illness. The vaccine is recommended to those that are high risk.
Okay, and then the other question is, one person says, I've talked to some friends who are doctors in India. As I told you, people love to check around, and they are kind of not willing to take shots. And these are doctors from India. So what is your perspective on that?
I would ask them why. If here I don't have the option to not see a patient. In the emergency department, I treat anyone and everyone that walks in. I don't have a choice. Maybe the practice setup is a little bit different in India, but it's certainly, I would not recommend not taking the vaccine.
Okay, so that's a good point. What is the logic of the second dose after 21 days?
So the second dose is to provide the booster to get you to 95% immunity or efficacy. So with the first dose, you roughly get 40 or 50% of the immunity efficacy, and that second dose gets you to 95. And so it's almost like a booster to the original shot that you got.
Okay, all right, thank you for that one. Now the other one is, what is your opinion on children and how to keep them safe, as they are too young to qualify for a vaccine, but they can easily carry the virus or still get sick from it?
Yeah, and children have, the population and the data is very mixed. We're not seeing very large numbers of cases in very young children. Your high schoolers and your junior high schoolers, and as they get beyond this age is when we really start seeing it. But the number of children getting it and having any kind of severe illness is extremely low. So there currently isn't any sort of recommendation other than to, take the same precautions you would. I wouldn't take them to Chuck E. Cheese or, any large crowded gatherings and put them at risk, because they may do fine, but again, they may bring it back and infect those that are high risk in the household.
Okay, great point. Somebody also asked about if they've been tested positive, would you recommend waiting 90 days before you take this shot, the vaccine?
Yeah, there's thought to be up to 90 days immunity after you've had the actual COVID infection. So you can certainly wait 90 days and get a 90-day extension on your immunity, for lack of a better explanation. And that's considered completely fine. Getting it immediately after you've recovered from the COVID infection is also okay, but it's thought that you already have immunity from the actual infection for 90 days. So it's certainly okay to wait.
Okay. Another question is, can you touch on the importance of taking the flu shot while we wait for the COVID vaccine?
Absolutely. So flu is, fortunately, we're not seeing a lot of flu. And some of it may have to do with the precautions we're taking due to COVID and masking and, this prevention of these large gatherings and everything. We're not seeing a lot of the flu, but it's still there and it's still appropriate and a good idea to take the flu vaccine. Flu has been put on the back burner. Nobody talks about flu anymore because COVID is much more popular, but flu it can also be a pretty miserable experience. And it's certainly recommended to get the flu vaccine as well. You don't want to take both of them at the same time. If you get the flu vaccine, you want to wait at least 2 weeks before you get the COVID vaccine. Or if you get the COVID vaccine, complete the entire COVID vaccination, both doses. And then after your second dose, I would probably wait 2 to 3 weeks before you get the flu vaccine.
Okay, very good. That was very important. We have a nurse. She says she has a lot of patients that have asked this one common question, that there's been cases of reinfection from COVID. If one person developed antibodies after becoming infected and they still can be reinfected, what makes the vaccine any better? What's to say I won't be infected even after getting the vaccine?
No, there's nothing that says that. You could be one of the 5%ers that didn't get any immunity from the vaccine. So, there's nothing that says it, but I would take 95% over 0%. The other thing with the infection itself, there's thoughts that depending on how bad of an infection you had, there's varying degrees of immunity after. So if you had a very mild case and you didn't have a very large viral load in your body, your immunity may not be as robust as somebody that had a pretty bad course with the virus. And that's why even after an infection, it's recommended to get the vaccine. So the vaccine is proven, okay, 95% of folks are becoming effectively immune from it. And so there's nothing, the length of the immunity is what is not known. And that's why people that had maybe COVID in early April, they know for 90 days, they're not seeing many people get reinfected, but after 90 days, it's unknown, and there's definitely a risk there. That's why even after the vaccine, you continue wearing your mask and distancing and doing all the precautions.
Right. Great. We've got some great questions here. That's awesome. This person just wants to tell others about this presentation, of how well of a job you've done also. And what does LPVV stand for? I guess that means LPS. That stands for Leva Patida Samaj of USA, which is a national organization for our community. It's close to over 10,000 members, and we formed this organization in 1989 from our forefathers back then to continue to keep our identity alive in this country and continue to pass on our heritage and culture to our future generations. So, and we want to keep that going. So this is why we have this association, and they could definitely visit the Facebook, but we also have put it on YouTube, and you can go to Joy Academy, which is who our partnership is with, for this presentation if you do want to pass it on. The next question is, do you recommend breathing exercises even before they get the virus infection?
I think breathing exercises are, and if by breathing exercises, if they're referring to maybe pranayama or something, there's not any robust science or studies that show that it gives you protection or prevents you from getting severe illness. But overall, it's great for your health. So in particular during these times, it's probably great just for mental well-being to practice breathing exercises to keep your mentally sound and keep your overall health in good shape anyway. So not sure if there's any definite benefits, and it won't prevent you from getting COVID. There may be some benefit in preventing you from getting severe illness, but it's not something that's studied, so hard to comment on that. But overall, still a good practice.
Breathing is naturally good for
very good.
Yeah. And now we have these watches, the Apple watches that help with the breathing throughout the day. The next one is kind of like a comment. I would like to share it with you too. Is like, we would like to thank you very much, Dr. Desai, Nancy, Vipin Bhai, and all other members and associates to bring this very important presentation and knowledge to all of us throughout the country and the world. When I was brainstorming this with even Vipin Kaka, we're thankful we came across you, Dr. Yagnesh Desai, and wanted to make sure that as an association president who's leading in one of the most difficult times, I mean, yeah, Jimmy had some months, but I came into the heart of it. And taking a leadership at this time means membership engagement. What can we do for our members? And as a community association with my team of officers and my board, it is up to us as leaders to come in and engage our membership. So definitely we appreciate that comment, and we'll continue to bring in a lot more sessions. We've done a lot in the past with Troy Academy too, and bringing in other sessions. But yes, we thank you for that comment, and I see you're becoming very, very popular, Dr. Yagnesh.
Well, I appreciate it.
And then I have another one that says, can you touch base? We just got a few more to go, just a couple.
Sure.
Yeah. Can you touch base on things patients can do at home if they contracted COVID and are quarantined at home, like vitamin C, oxygen if needed, prone positioning, expanding the lung, turn cough, and deep breath?
Sure. So if you're requiring oxygen, some places in the country are actually, due to restrictions and no space available in the hospitals, they are having to send patients home on oxygen. So you shouldn't be using oxygen or somebody else's oxygen unless it's been instructed to you to use or prescribed for you to use by your physician. I wouldn't recommend just going in, taking another family member's oxygen and using it, because you have to know how much to use and how to receive it. You don't want to just be putting oxygen that you don't need. If you are healthy enough, your disease is not severe enough that you need to be in the hospital, you're able to go home. There are some things. So vitamin C, zinc, and vitamin D are the three supplements that there's been a lot of talk about. These three supplements. How useful are they? The data is still a little inconclusive on how helpful is it in actually helping you get over COVID-19. They're thinking vitamin D may be a little bit more effective, but again, it's nothing that's been approved by CDC or FDA that it's a definite help. That being said, taking a normal multivitamin that has these supplements, it's probably good practice. They do help support a healthy immune system, and that's more than what you can do. Me personally, I'm exposed to it on a daily basis. I'm not taking any of these supplements, but it's certainly taking a normal over-the-counter multivitamin that includes your daily amounts of vitamin C, zinc, and vitamin D. You're good to have a well-tuned immune system, and overall having a healthy diet, where you're getting plenty of fresh fruits, vegetables, you're getting milk that's going to have your vitamin D, and getting enough sunlight, which also helps vitamin D in your bodies. And then the other things, if you are sick with COVID-19, you're at home, you're going to be pretty miserable. You may not want to get out of bed, but you want to force yourself to stand up, to walk around as to the best you can, and completely expand and fully inflate your lungs with a full breath. When we're lying in bed and we're not really moving, our breathing becomes much more shallow and we don't fully expand our lungs. So you want to change positions when you're awake. You want to turn to your sides. You want to turn to your stomach. You want to stand up. You want to sit up, and you want to move around, walk around, in order to get full expansion of your lungs, to keep yourself oxygenated and fully ventilated.
Okay. And I do want to remind our participants that, this session is much more for you to be informational and educational. Everyone needs to consult their own physicians because that they know their underlying conditions. So just for the individual needs, everyone that has their own doctor knows what's going on with you. So just make sure that this is just our informational, educational awareness session, but do consult your doctor. And with the question about, goes back to the one about some of the doctors that didn't want to take the shot. The reasoning that question was asked was that this person had sent that message again, saying that not taking a shot is because they felt that the vaccines have come out in a very short time, and that it lacks clinical experience. And you're one of those doctors that are in the forefront seeing patients. You just said it several times throughout the presentation that we're too quick into this. So,
right. Normal vaccinations, the normal process is, 5 to 10 years. We don't have that sort of time and luxury to roll this out. And normal vaccines are based off of actual, weakened strains of a virus or pieces of the virus. This is a completely different sort of vaccination in which no virus is actually injected into your body. And the piece of mRNA that's used, it's destroyed by your body after it carries out the instructions that the mRNA provides. So it's a very unique sort of vaccine. The other thing about it is it was tested on roughly 74,000 individuals prior to rollout, but given the situation we're in, it certainly doesn't benefit us to do a 5 to 10 year rollout here, particularly when the vaccine that's been provided is so simplified and relies on your body to develop an immune system rather than injecting other things into your body.
Okay, perfect. Another one is, can you please comment on people who have long and short flights due to necessary reasons? And maybe some comments on that.
Yes, as far as taking flight, sometimes it's hard to avoid that if your work requires it or whatever. You want to make sure you take your normal precautions. If you're able to select seating that's away from people, you want to certainly do that. Obviously, wear your masks and keep it on at all times. Keep hand sanitizer on you. I've had people tell me that those that are traveling, they carry disinfectant wipes, or even I think Lysol is making small travel acceptable cans of Lysol. And as soon as they get to their seat, they spray the entire seat. They wipe the seat belt, the armrest, the tray top, and everything, and try to make it as safe of a clean of an environment as they possibly can.
Okay, and on those flights, do you think there's enough spacing? Because some flights might be next to each other, and then some must be.
Yeah, that's certainly not 6 feet. So, it's unfortunately what the airlines have to do and what they've been given permission to do. So,
yeah. So how long does it take to get back test and smell? Because if they've been infected for 90 days ago and they still don't have 100% case, what is your experience with patients within your facility that you've noticed?
That's been a very variable thing. A majority of the folks that I've spoken with have gotten their smell and taste back roughly over 30 to 60 days after having infected. There is one poor person that I've known, she's had it for 6 months ago and still does not have her smell or taste back. So it's a little unpredictable. There's no definite time frame on when it's returning on folks. But majority of the people get it back fairly quickly afterwards, but there's no guarantee there.
Okay, so it's so that's what you've been noticing with your patients within your facility. Like I said, this is so new, you can't tell anything. I have another one that says, and I think you kind of answered this because you said we don't know yet, but how often do we need to take this vaccine? Do we have to take one every year? I think you already kind of answered that. It's too new, right?
Yeah, it's too new, and we don't know what the course is going to be yet. Is it going to mutate and become a completely different type of virus that we have to develop a different vaccine for, or hey, will it continue to be responsive to the vaccine that we have? And it matters how quickly we get people vaccinated to where we can hopefully stop the spread and get control over it.
Okay, I have one more last question, and one lady that's raised her hand, and then we'll try to wrap it up. Does the failure to get a second dose of the COVID-19 vaccine in the required period of time make it ineffective? Great question.
No. So looking at what the guidelines are, because there's many places that they're telling vaccination centers, if you have a vaccine, don't hold it for the second dose. Give it to everybody and worry about the second doses as you get them. You can continue giving them. So it's not felt that even if you miss the 21-day period for the Pfizer, or 28 days, do you have to start over? No, you do not. You can still get that second dose, and they feel it's still going to give you the same efficacy and immunity.
But what if they just don't take that second one? Would that?
Then you will not have full immunity
Yep.
of the vaccine.
Yep.
You will be still fairly high risk of catching the disease and severe illness.
Great. I'm going to allow Jaya, who's been patiently waiting, of course. She wanted to shed some light, and then let that one person come in. Jaya, I'm going to unmute you. So when you have a chance, go ahead and speak.
Yeah,
Jaya.
actually it's not Jaya, it's Hemant, okay?
Oh, sorry, Hemant. Hemant by Miami.
All right.
Let me introduce you first. He's one of our past board of directors, and he was one of our officers on LPS of USA too, and also past AHOA chairman, just like Jimmy. Jai Shri Krishna.
Jai Shri Krishna, thank you. First of all, Dr. Desai, thank you. You have given a valuable time, because as you are talking, you know how the doctor's time is spent right now. So we appreciate your time and everybody who organized and joined this call. I happen to share a unique experience when I had my father and mother both got infected by COVID in India. Unfortunately, I lost my father in the hospital. Very healthy man. At the age of 81, he used to still ride a motorbike, but I don't know, maybe borderline diabetic or whatever, but it was during the peak time in India in August where both got admitted. But one interesting story I wanted to share was my dad and mom were in India taking care of my 106-year-old grandmother. And they used to sleep in the same room because my dad and mom had to take turns at night to take Ma to the bathroom. Interestingly enough, my grandmother had no mask, nothing, and she did not get any symptoms from COVID. Yes, I did end up losing my grandmother after 2.5 months because probably she took it as a shock of losing my dad. But that gives me a question that yes, immunity does play a role, because everybody says seniors are high risk. My grandmother showed no symptoms whatsoever. And I was constantly in talk with doctors who were treating my father at ER in Surat, talking about what medication, what not. My dad had pulmonary fibrosis and then ultimately organ failure due to cardiac arrest and pneumonia. So it's interesting experience that you get, we're educating people, and we appreciate your time, but this is a learning process for all of us, and immunity does matter. So, I think it's very important that we put our body, we put our unleaded, super unleaded fuel in our stomach to keep our immunity strong and stop eating all the garbage food.
All right, thank you, Hemant Bhai.
That's the only experience I wanted to share, and a lot of people have lost their loved ones, so I feel the pain.
Yes, on behalf of myself and the LPS and Joy Academy, we're very sorry that you lost someone so valuable. And that's just one more example that Dr. Yagnesh Desai was saying, that for the matter of for our own people, try to practice safely and just follow the CDC guidelines and your doctor's advice. So
right.
I appreciate
and
it.
of course, we pray for the well-being of you, doctor, and every medical professional who have constantly put their life online to protect a lot of us.
Yes,
you.
like I said, there are
Thank you.
gods right now. So thank you, Hemant Bhai. You always give us valuable input and really appreciate it. And may God bless you too.
Thank you.
And your family to be safe at the moment.
Thank you.
So, Dr. Yagnesh, before we end, I do want to do a couple of thank yous and then take your final say to the session, and then we can end this. First and foremost, of course, I would like to also thank Joy Academy, especially Darshan, Dr. Kansagra, who's helped me with this presentation. Of course, Vipin Kaka for bringing the resource to me as soon as I pick up a phone. He's so helpful to me whenever I come up. He knows I'll just pick his brain on some resources when I come up with some suggestions that I need from him. We really, really appreciate all of these people, because this event couldn't have been done, and this session couldn't have been done without our core people. And we would like to thank my officers and of course my board as well. And then just remember that the session was, like Hemant Bhai and all of us have said, that is to enlighten everybody, educate everybody. Everything is so new. We don't know what the outcome's going to be. How long is it going to be? Everybody thinks 2020 is behind us and 21 and we're going to be back to normal bouncing. It's not going to happen. Sorry to say, it's not going to happen as quickly. Dr. Desai, you've enlightened on that this time. You're the frontliner in your facilities. You're experiencing things. So we want to tell our the participants that have watched this today and are going to continuously watch this, whoever watches this, please understand, follow the CDC guidelines. Consult your physician. Take care of your health, because your health is your wealth. And please be mindful of the people we have at home. Again, I stress that if we don't take care of ourselves, we'll be sitting in a hospital room by ourselves and possibly die without even seeing our family. And if that's what you want, then it's your choice to take that opportunity to do that. But at the end of the day, don't risk others. We can go back to normal life when things get better. We will always get to see each other. It's better not to see each other now. Like Bipin Kaka said, I'm telling everybody no. It's a reason. He wants to live longer to see you guys later, you know, because we will have many years to visit again. Dr. Desai, as in your closing remarks, I would like you to touch on weddings and funerals and social gatherings as you end this, because amara samajma itlu to tame boila ke khotu nahi lagawo jo if somebody invites you ne koi tamaro invitation accept nahi kare, or like Bipin Kaka na pale na ઘર માં એ ખોટું નહીં લગાડવું જોઈએ. આપણે respectfully we should understand. આપણે જ વિચાર કરવો જોઈએ કે કોઈના ઘરમાં પહેલા ગઈએ તો આ સિચ્યુએશનમાં પહોંચો કરવો જોઈએ. પેલા લોકો તો અમુક people તો ના નહીં કહે, પાછું જમવાનું બી થાય ને પાછા કેટલા કલાક હાથે spend કરે. વિચાર આપણે જ કરવો જોઈએ. So having said that, I again want to make sure that everybody, you consult your doctors and stay in the guidelines, and whatever Dr. Desai has enlightened us today, please take some thought into it. We're welcome if you want to email any questions you may have. You may email at least me at info@lpsofusa.com. Even with Joy Academy, we're willing to help you, you know, answer some of those questions I may not have got answered today. Raman Uncle, I'd like to thank you. You're part of Joy Academy too. You've been very silent. Before I close it off, if you have any final remarks, Raman Uncle, please do so, because you're also one of the faces behind Joy Academy.
When Nancy became the president of LPS, her goal was, everybody is in the four walls during COVID, nobody is able to get out. What can we do for the Samaj members? So we got in touch with Dr. Pradeep Kansagra and Darshan, and they joined and helped us to launch to help us use the Joy Academy's technology and to help our Samaj members to get education sitting at home regarding anything and everything that is happening, what we should do, what we should not do on different topics, whether it was related to heart or diabetes, whether it was kidney, whether it was wealth management, retirement. And now that the vaccine is out, Nancy decided to do something based on vaccinations, because people are getting a lot of mixed messages and myths and realities. So we said, let's remove all that cloud and see if we can help our community members to decide on for themselves what to do. But it's our responsibility to give that education. And Nancy, thank you for taking the leadership. Dr. Kansagra and Darshan, we are always indebted to you for your services to the Samaj and to the Gujarati community as a whole, not just Lewa Patidar Samaj, but all the other Samajis also are taking advantages of Joy Academy. Thank you.
Thank you, Ramananko. Great inspiration for us. Thank you, Ramananko. Dr. Desai, I'm going to give you your final closing remarks, and we can get back to normal life. I guess there's a football game on today. Everybody's watching from home.
Sure. Well, in closing, I just want to say thank all of you for joining us today to educate yourselves and to inform yourselves. Hopefully, we've clarified any confusion that you may have had. Please try to remember that this is still a very new disease and a very new virus, and it's causing a lot of things to change and a lot of information to be gained very quickly. So when CDC or the health experts recommend one thing in the beginning and then they turn around and change it, please don't take that as, oh, this is a conspiracy or this is all, craziness. This is based off of the information that we gain as we learn more about the process. We have a very small flashlight and we're walking through a dark forest. So we can only share what we can see. So please understand that. And ultimately, what has been shown to keep folks safe are the three basics of wearing a mask, distancing yourself, and using proper hand hygiene to keep yourselves from contracting any germs. I hope all of you will have the opportunity to get the vaccine. That is a huge benefit for us in this fight against the virus. It can potentially help us turn the tide against this virus. If a large enough of the population is able to get vaccinated in a short enough of a period of time, we can potentially gain control over this virus and get back to what we considered a normal life that we used to live. It does require all of us to be a little less selfish and think of others to keep everyone safe, not just ourselves. Many of younger folks, we are not at risk for developing severe illness, but we are very high risk to those around us of spreading the disease. And it's very important that we consider each other in addition to ourselves to protect all of us and to move us out of this virus. So in closing, thank you very much for the opportunity. I'm blessed to be able to do this. I want to wish all of you a healthy and safe 2021. And please take care of yourselves and your families and friends.
Thank you, Dr. Yagnesh. Great job, and we'll keep you in our prayers as you're a frontliner for us. We'll keep you in our prayers just like we do all the rest of the doctors and nurses that are out there and all the other frontliners. I mean, without them, currently you are our gods for us as well. And I want to thank, of course, Karina, J. Jimmy Patel, Surakanti and Chanuncle, and of course, Vipin Bawaji for sharing their experiences. And I hope everybody continues to stay healthy and safe. And I want to thank again Joy Academy, Darshan, and Dr. Kansagra. And may everybody stay blessed. And let me tell you one thing, a community needs to come together and stay together, and we'll all be together soon. So just want to say, everybody, Jai Shri Krishna on behalf of myself as the president and the officers in the LPS USA board.
Just as the last comment, I want to see if our Samaj members can help those that are financially challenged to get all the government benefits and all the payouts that the governments are making, to spread that word and see who are eligible to get that support from the government in terms of money. and some people may not know about it. So if you are in your community and you find somebody that's financially challenged in our community, find out if they're getting the checks from the federal government, the unemployment money that they are supposed to get legally. Are they getting it or not? And if not, please help them out.
Great point. COVID has put a lot of challenges in many ways, health, financial. People are worried about keeping their homes. Can they make the next rent payment? Is their job stable? The businesses are not stable. What is this 21 going to bring for all of us? Like Jimmy said, we're taking care of our employees, but the business. So technically this COVID-19 has damaged us in many ways, and we just all got to come together and help each other out. Let's uplift each other. Let's be there for each other. If we can help, let's help. That's the biggest message we can give. This is not a time to let people stay down. Please, I'm encouraging that everybody help each other out without any judgments. So thank you so much, Darshan. If we can end this, and thank you again. Mm-hmm.
I got one comment, just one remarks.
Okay, go ahead.
So Babaji was thinking about 2019 COVID, 2019. પછી આવ્યું 2020 એટલે ઝેર. પછી આવ્યું 2021 2021 પાછું ઝેર આવ્યું, 2022 પાછું ઝેર આવ્યું, 2023 પાછું ઝેર આવ્યું, 2024 પાછું 20 આવ્યું, 2025 સ્ટેબલ થયું, 26 27 28 29 30 31 પછી બધું શાંત થઈ ગયું. એટલે we need to watch ourselves for next at least 7-8 years. આ ઝેર કોવિડે ઝેર બધે પસરી લીધું. આ વિચાર કે 2020. Thank you.
Yes. All right. Well, thank you so much. And thank you for the participants that were part of this. We really appreciate it. Darshan, we'd love to end this now so everybody can get back to their normal lives and be safe and be with their